diagnosis of OCD, hysteria, and homeopathic view. Okay, so did I not start my video,
No,
Rishmika?
doctor, you haven't started.
I'm sorry. Okay.
Yeah, I will go off now.
No, it's okay. So, friends, let us talk about diagnosis, prognosis of OCD, hysteria, and hypochondriasis, a homeopathic view. But before that, first of all, let me thank you, Mr. Karthik Raghavamurthy and Dr. Rashmika for hosting me on such a beautiful platform where we get very quality audience who can understand and who can suggest even few changes to us. So today here I am to talk about the psychiatry. As you all know everything about me, so directly moving towards our session. First of all, friends, let me talk about homeopathy. See, we all know that it is a pathy which is based on this law of similia similibus curantur. But it's not enough, trust me. It is a wonderful science based on the natural law of similia where we treat others as we would wish to be treated. It is the science of an individual. And that's why we say that homeopathy is a pathy of personalized person. Here we do not prescribe the same remedy to every person because we individualize the patient, we individualize the disease, we individualize the case, and finally we individualize the drug. So our pathy has four unique characteristics. That's why homeopathy is known as gentle and non-toxic pathy because we deal with the emotions and feelings of the person. See, in Hindi it is said that भावनाएं दिखती नहीं है मगर दुखती है. It means that you cannot see the feelings, you cannot see the emotions, but you can understand the pain of the feelings and emotions. And where is the role of homeopathy actually in our life, where we cannot see anything abnormal in our lab investigations, in our machines, and mechanically there is no trouble, no structural damage. Still the patient is in trouble, then there is the perfect role of homeopathy. And that's why homeopathy and psychiatry are friend indeed, friend indeed, friend in need. Understand? Now, what is homeopathic psychiatry? Here, a homeopath dispenses a similar medicine to a patient suffering from mental and emotional disease to cure him. And why homeopathy? Like we have lot of pathies in our world today, and we are practicing them. People are getting benefit from allopathy, Ayurveda. Then we have Siddha, we have natural medicines, yoga therapy, everything we have. In foreign, we see that aromatherapy, ozone therapy, bioresonance. They are following lot of things. Then why should anybody approach to homeopathy for particular psychiatric disorders? Because according to our pioneer, Pierre Smith, he said that homeopathy is a challenge for the mind and joy for heart. Where physician gets involved with his mind and heart, he understands the mental and emotional sphere of patient much better than any other school. And hence homeopathy is a better choice. Because throughout the world, only homeopath is the person who pays importance to the emotions of the patient, even when the patient consults us for just simple knee joint pain or just simple injury. Still then we ask him, how about your dreams? What are your desires and aversions? So we pay the complete attention to our patient and we understand our patient emotionally, physically, spiritually from every angle. Now, can homeopathy really treat psychiatric diseases? No. Homeopathy is not able to treat psychiatric diseases or metabolic disorders or any type of organic disorders because homeopathy do not treat the diseases, it treats the person in the disease. So here we are to look beyond the person. There is something which is hidden behind the person and we have to find out that. And that's why we say that we always search for the root cause. If you hammer on the root cause, then only you are able to provide the cure. I'm talking about cure, not recovery. Temporary recovery you always get with painkillers and antibiotics. But relapse is there. But when you do not want relapse and you want to provide cure to your patient, permanent relief, then it is known as, then there is a role of homeopathy. Now let us talk about neurosis and psychosis. What is psychosis and neurosis? In our modern lifestyle, our lifestyle has become totally hodgepodge. All day we are working, running here, and there is lack of communication for second feeling. And because of our stressful lifestyle, we have psychosomatic disorder somewhere in our life. It is there. Some psychosomatic component is there in our life. And that's why we are getting lot of cases of neurosis and psychosis as compared to the homeopaths from last era. Because in last era, our homeopaths were used to deal with epidemic and pandemic disorders more as compared to psychiatric disorder. But in our modern era, due to our hectic lifestyle, we are landing more in psychiatric disorder. So what is psychosis and neurosis? Psychosis is from physical to mental. Neurosis is exactly opposite from mental to physical. Psychosis is always with organic changes and behavior of psychotic patient is not acceptable in the society. But neurosis is with the functional changes only and they are not trouble to the society. In psychosis, there is fleeting sense of reality. There can be delusion, hallucination. But in neurosis, there is awareness of reality. Now, what is this? Let me discuss some common terms of psychiatry. Anxiety and fear. Nowadays every patient talks like in our medical language. Patient is talking in medical language. Doctor, I am feeling anxiety. I have this phobia. No, my dear friends, these are the words for us, for the medical practitioners. You need to understand the difference between restlessness, palpitation, and the anxiety. The difference between fear and the phobia. Understand? So, what is anxiety? It is related to a general state of insecurity that often you cannot relate to a specific subject, like anxiety about health, anxiety about future. We use the word anxiety for the broad spectrum. We do not say it like this that there is anxiety of accident or there is anxiety of death. No. Fear of death, anxiety of health. We do not use the word fear of health. We say anxiety about health. So, what is fear? This is the anxiety focused on a certain object. You know about anything. Like today, we are getting lot of patients who says like this, Doctor, I have anxiety about diseases, but I have a fear about corona disease. They do not utter the word like this. I have the anxiety of corona disease. No, it is specific about some disease, then it becomes fear. And if it is in a broad spectrum, you are using the term as a generalized term, then you are using the word anxiety. Understand why I am explaining this? Because it will help you to select the rubrics in recovery. Where to pick the rubric from anxiety and where to pick the rubric from fear rubric. Okay? Now, what is phobia? It is like confrontation. The anxiety or fear is experienced as you approach the situation or the object. It is more like an organic state. Example, claustrophobia. When you go to tunnel, phobia increases, otherwise it is silent. When any person entering the lift, he suddenly becomes fearful. This is the phobia, this is the claustrophobia. The patient is not able to travel in the lift. He cannot ride in the elevator. And what is panic attack? When patient feels that I am trapped, I am locked, not to escape feeling. I am locked in this particular situation. I am locked because of lockdown. I am not able to go outside, and that's why I am getting anxiety and restlessness. Then it is known as panic attack. And for such panic attacks, we have the remedies aconite, gersemia, argentum nitricum, glonane, and naxonica. I have used all these remedies with free hand during lockdown period because getting lot of patients suffering from panic attack. Now, what is OCD? OCD is the common and the most important disorder nowadays which I am getting in my practice. What is OCD? Obsession, it is a thought, an imagination, an impulse coming from brain against your will. It is on mind level and not in behavior. OCD means anxious thoughts coming out from the brain or mind and pollute the consciousness against your will. You do not want them to come out, but they are coming out against fighting you. They are fighting with you. And what is compulsion? See, in obsession, thoughts are only at mental level. Like there is a feeling of dirty feeling from the contamination or fear of contamination. That is just the obsession. But what is compulsion? If patient sees dirt anywhere, he just picks the broom in his hand and he will start the cleaning. That is compulsive disorder. This he has to do the cleaning. Washing mania. It is the example of compulsion. Compulsion is the manifestation of thoughts and now with the behavior. It is the further stage of obsession. Few common OCDs are aggression, violence, religious obsession. Like many people are too much religious. They do eat anything because of fasting. Though they prefer to die with hypoglycemia, but they are not ready to break their fast. Cleanliness mania, suspiciousness, checking the things frequently, and friends, lobacity is again a part of OCD. See how we are getting a strong syphilitic mindset behind our OCD. This is again modern era's OCD. All the time we are checking our phone. अरे कोई WhatsApp आया है क्या? Is there any new notification on your phone, Facebook? So WhatsApp, Facebook, computer games, and modern era, all these are modern era OCD. Like PUBG was also a OCD. And these all OCDs are landing you in the isolated field. Now let me discuss few rubrics which will help you in your practice. Like monomania. It listed 46 medicines in synthesis repertoire. Few cross references given like autism, insanity should not be considered while dealing OCD. Thought persistent means you do not want to think, but still you are thinking, thinking, thinking. You cannot control your thoughts. It is known as thought persistent, and we have at least 151 remedies for that. Differentiated with the individual patient. Then thoughts tormenting. We have 40 remedies for that. Forgotten feels constantly. He has forgotten something. It is for OCD you can pick this rubric. Patient always says, डॉक्टर मुझे लगता है मैं कुछ भूल गया हूँ, but मुझे याद नहीं आता कि मैं क्या भूल गया हूँ. I feel that I have forgotten something, but I am not able to recollect what I have forgotten. Then comes irresolution. Irresolution means what? There is lack of tendency to take the decision. Patient is indecisive along with lack of confidence. When these two things unite together, the word becomes irresolution. Use it when patient says, did I lock the door? He will go and check the door twice. Or he will go and check the gas knob whether it is switched off properly or not. At that time, you can consider this rubric irresolution. See, we have few rubrics in repertory regarding irresolution. That is irresolution in acts, irresolution in choosing things, then irresolution about life choices, like whether I married a correct man or not. Then you have only one remedy and it is a homework for you. You have to search which remedy is this. Then irresolution about shopping. There are many people, they go for shopping, but they just go to and fro, to and fro. They shop so many things and then they drop it because they are not able to decide which sari they have to buy or which thing they have to buy. So, if there is irresolution during shopping, you can think about the remedy ozone. See, there is a great difference between ozone and helium. Helium we use in autism because they are totally disconnected people with the world. But we can use the remedy ozone in such conditions. Then want of self-confidence. It is again a rubric for OCD. Fear of impending diseases, fastidiousness. You know fastidiousness is OCD. And we have all these syphilitic remedies under this rubric like arsenic, naxomica. Then consent is about refers. I want this thing like this only in this perfect manner in this particular order, then I won't change it. Doubtful, forgotten what has just done, memory weakness. It is again a part of OCD, because nobody just want to do this or nobody just want to forget everything. But this is the thing which is happening against your will. Then sometimes you can be impulsive. Consider the rubric impulsive, desire to do certain things. There are a lot of impulses. Sometimes we get the impulse to slap the other person. So again, it is a part of OCD. Then impulsive morbid, want to hit or kill somebody. Fear to be left alone. He should injure himself. This is again a rubric for OCD in our repertoire, and we have two remedies to save such patient, that is sepia and nitroglycerin. Then there are few more rubrics like kill desire to. For example, barber wants to kill his customer. Why would barber want this? He doesn't get any benefit from his customer. If he will kill his customer, he will get only prison, nothing else. He won't earn anything. But still there is this feeling in the barber because of this thought is coming out from his mind against his will. To kill beloved ones, to kill himself sudden impulse, to throw child into the fire. Like we have remedied sepia for this. In sepia it is mentioned that she just want or sometimes she even can throw the child on the fire. Then we have one rubric, mutilating his body. It is totally syphilitic, but it is OCD. To do serious changes on his body. Like we see in foreign, I saw a lot of people doing the tattoo mark on the whole body, whole body. Even they do not need to wear the clothes because their whole body is just, they are hiding the body with the tattoos. But it is not easy to make the tattoo. It's a painful procedure. But still, if somebody is doing these serious changes to the body, which is permanent, if they want, they cannot erase it. But still, they are doing it. So you can take this rubric in this case, mutilating his body. Then we have one more rubric, that is suicidal disposition. Nobody wants to commit suicide, but somewhere some thought come against the will and it compels you to do this. So suicidal disposition is always a part of OCD. So till now you must have understand that how important is it to deal the patient, to remove the OCD from the patient. Then we have few more rubrics like always washing her hands, washing mania, fear of impending disease, guilt, anxiety of conscience, remorse, reproach himself, or double checking. Like once they lock the door, but still they will go and check it again because of irresolution. They do not have the confidence in themselves, and they will ask or confirm everything twice or thrice from you because of their suspiciousness. Then common OCD we get in the practice. First is eating disorder, like bulimia and anorexia nervosa. See, sometimes what happens nowadays, I see girls eat everything and then they do induced vomiting by putting fingers in their throat so that they should not put on the weight. Though it is an abnormal and unnatural way, but still they are doing it. So if anything is unnatural, it is always a syphilitic mechanism. So for such patient, we have the remedies China, arsenic, calcarea, and Merxol. Unnecessary compelled eating followed by induced vomiting or fasting because of delusion obesity is a type of OCD. Then gambling is again a part of OCD. We have a rubric, passion for gambling. For example, and we have the remedies Naxomica, Lycopodium, sulfur, platina, and veratrin. See, gambling is not related to game or gambling of cards and money. No, not only that. It is not limited till this phrase only. But the gambling means they are playing high risk games in their life too. They are the high risk takers. So you can consider these rubrics. When they take the risk without thinking about the future or without thinking the effect, what will happen. Then we have one more rubric, that is pyromania. Fire wants to set everything on fire. Pyromania is a compulsive need to burn fire, see fire, and enjoy fire. So we have the remedies for this, aconite and ammonium mule. If there is desire to be near the fire, we have the remedy NASA. think and talks of fire. We have the remedy alcohol. Mania with disposition to commit murder by incendiary setting on fire is a rubric of remedy alcohol. So we can give this remedy and we can change the mind of the criminal mind of this patient. In the further slide, I am going to show you a small video clip of the criminal mind where you will justify, you can see the justification of this rubric, the pleasure from the fire, pleasure from seeing fire, and there is enjoy in watching the people who are burning in the fire. Imagination, frightful vision, and dreams of fire. For this condition, we have the remedy Hypochondriasis. See, such people who are suffering from pyromania, they enjoy fire. Just enjoy this video clip. Did you observe the joy in the cruelty? He is smiling with the sounds, with the shouting and screaming sounds, and he has the pleasure, he is enjoying the fire. So we can consider true regret, joy in cruelty. For that we have the remedy anacardia, and you can consider this regret pyromania. For particular this situation, we have the remedy alcohol. Then habits of cracking the knuckles like this, like finger joints feels compelled to make them crackle. We have the remedy nephritis. If there is nail biting is again a part of OCD. If there is nail biting, then we have the remedies aconite, arsenic, aurum triphylinum, sina, lycopodium, medorinum, senecio aureus, stramonium, and nitramur, sanicula, and hyoscyamus. But why there is nail biting? You have to differentiate the remedies according to the materia medica. Why there is nail biting? Is it because of fear? Is it because of lack of confidence? Or something else is behind it? Understand? So always whenever you consider any rubric, just justify your rubric clinically with the materia medica. Then washing always her hands. We have the remedy syphilinum, the top grade remedy. We may have various remedies in repertory because we are using lot of different remedies repertories we have, and we are using various repertories. But what I mentioned here only the top remedies, and from which I got the result in my clinical practice. Walking rapidly from anxiety. We have the remedy argentum metallicum, acid floor, and sepia. Then mania to work always, that is workaholism. Mania, pagalpan. We have the remedy aurum, barretacar, hyoscyamus, ignitia, crocus, lachesis, opium, sepia, tarantula, and thuja. Now, why aurum and sepia and lachesis and opium are workaholic? Because of their duty-prone behavior. Why Tarantula has the mania to work? Because he has to liberate his energy. He has to liberate his hyper excitability of the nerves. We have few more remedies there. Like we have Brainia under workaholic nature. Why Brainia is workaholic? Because is a fear of poverty. Patient has this fear that he will get poor in the future, and that's why he keep on working all the time to store the money. We have the workaholic rubric under the remedy Naxomica. Naxomica works all the time because of his fastidious, wants everything according to his order, and second thing, he is ambitious. He just want to achieve the big goals in his life. Then we have one more remedy, that is arsenic. We have the arsenic also under this workaholism or fastidiousness. Why arsenic is workaholic? Because he wants everything in the perfect order, and that's why he keeps on working all the time. So friends, whenever you pick any rubric, just justify it with the materia medica all the time. Now next rubric is tormenting everyone with his complaint. Sometimes we have such patient, like daughter-in-law comes to consult us, and she complains that my mother-in-law is such a gloomy lady, such a irritating lady. She keeps on tormenting with her complaint. Whenever anybody comes to our home, my mother-in-law just tell them that my knees are paining, my daughter-in-law is not functioning well, she is not fulfilling her duties, she is torturing me, so and so and so and so things. For such patient, to shut their mouth, we have the remedy zinc med. Give him in the high potency, not less than 10 ml. Then if the child wants to impel to touch everything, we have the remedy lycopus. We have the rubric touch, impel to touch everything. We have 26 remedies like Merck, Thuja, but lycopus is a very much well verified remedy in such conditions. Then jealousy is again a part of OCD. Jealousy as foolish as it is irresistible. And for that, we have the remedy lachesis. We know that we have a club in Matra Medica, Club of Jealous People. And the president of this club is Hyacinthus, Lachesis and Sepia are just members. Then there is impulse to play with one's hair and pull it like this. For example, lilium tail. Here don't consider the rubric desire to pull hair, but take restlessness of the hands under gesture, and then you will get the remedy Hyacinthus. But do you know what it is known as when the patient just pull its hair all the time? Its name is trichotillomania. It is a type of, it is a disorder, psychiatric disorder. When patient feels some anxiety, they just pull their hair. I have a patient who has cleaned her, who become bald from the frontal side by pulling her hair because out of anxiety. And other remedies for such conditions are arsenic album, belladonna, cuprum med, lilium tea, medurinum, meserium, and tarantula. Then we have one more rubric, that is kleptomania, a recurrent urge to steal without need. Patient is stealing the things, and the remedy is pulsatilla. We have many more, like we have artemisia, curare, but the top remedy is pulsatilla. Then habit of counting continuously, that is phytoleca and celicia. Then habit of thumb sucking. See, thumb sucking is a major psychiatric disorder. Always there is a why behind every rubric. Why there is thumb sucking? When parents are normal, everything is fine in the home. Then why the child is sucking the thumb? Because if the mother was irritable or she has been suppressed emotionally during her pregnancy, then you will see this habit in the child. Because the mental irritation of mother gets transferred to the unborn child, and the child may suck the thumb or he may suffer from the bedwetting. For thumb sucking, we have various remedies, but calcarea falls, natramure, and silicia are good clinically verified remedies, and even calcarea car. Then children putting fingers in the mouth always, not thumb sucking, but putting fingers like this. Mm. When they will talk like this. Okay, okay, like this. So we have calcarea, chamomilla, and ipecac. Ipecac 1 mg has been found to be very useful in such cases. The next dose is calcarea. Then coming to hysteria. Till now I talked about OCD and I explained lot of rubrics for you. The rest you can search from the repertory. But I suggested these rubrics because I just wanted you to understand which rubric you have to pick. Because sometimes what happens, you take complete case, but you do not know how to pick the rubrics. And here you lose your patient. And the patient loses his belief in homeopathy. So it's better to learn which rubric to pick in which case, in particular case. Now let me talk about the hysteria. What is hysteria? It is a part of neurosis like OCD. This produces restriction of feelings of consciousness and create disturbance of motor and sensory functions. Patient is unaware of her own motive of certain behavior. मुझे नहीं पता डॉक्टर कि मैं ऐसा क्यों करती हूँ. I don't understand doctor, please help me. But it happens suddenly. I don't understand why I am doing this. There is no motive, but still I am doing it. There are hidden motives that made them to do certain things. According to Greek medicine, hysteria word comes from the uterus, and lot of medicines which we use to treat hysteria are always related with the hormones like moisture or castoreum. See, in this picture, the lady publicly in the train metro, she is dancing. Who does like this? Without any motive, she is doing this movement. This is a part of hysteria. Exaggerated reaction to little injury is hysteria. Hysteria will manifest itself in various forms, and the most common form is what is called somatoform disorder. They will mimic a certain organic disease or a certain psychological state like pregnancy. Usually, we can relate these behaviors to psychological conflicts or problems. Example, in Hindi movie Dar, in which the actor Shah Rukh Khan played the role of obsessive lover who cannot accept the rejection in love and turned into a violent hysterical personality. We all have seen this movie. See, a gentle lover, and when he got the rejection, he became a suddenly a hysterical, violent patient who can even murder somebody. They will have various forms of pain disorder, and they really feel the pain. They will have pain everywhere in the body, but the pain does not make sense. You ask them, where is the pain? They cannot locate it. A pain that will go from here to there. Physiologically, it does not make sense, all kind of weird things, but they really feel it. They really feel the pain, which is really not present there, but it is there in their delusions. And we have few rubrics for hysteria. See, whenever there is rejection, you may land in hysteria. If there is rejection at the commencement of sex, you will land into hysteria. Just watch the movie Kamsutra. It is mentioned there when the princess got rejection at her first night at the commencement of sex. Her husband rejects her and she landed in hysteria and ultimately she commits suicide. So just go and watch it. Hysteria. Many polycrist and also some less important remedies like asafoetida on top. Asafoetida is hing. We use this spice in our kitchen. Coculus, nux moss, valeriana, then castoreum, crocus. These are the smaller remedies. Fainting hysterically. Coculus, ignitia, moschus, chamomilla, natramur, and naxomica. There is hysterical anxiety as well as we have hysterical laugh. See, who laugh like this? This is hysterical laugh. The whole body is laughing, not only the cheeks or face. Look at the mood and pick the rubric like extremes of mood, childish behavior, offended easily, criticism of others. They are too much sensitive to the criticism and longing for a good opinion of others. In hysteria, patient always has a longing for good opinion of others. And for that, we have two remedies in our homeopathy, that is palladium and platinum. And that's why these two remedies are very much useful in solving hysteria cases. Then there are only two remedies, but there are remedies that tend to be neurotic. There are which are complementary remedies. Then you can pick some rubrics sensitive to pain, sensitive to noise, sensitive to music. And sometimes we have one rubric that is globus hystericus. Where will you search this rubric in the repertory? Globus hystericus. Here. Lump in the throat, rising sensation. डॉक्टर मुझे लगता है मेरे गले में ना कुछ ऊपर ऊपर उठता है पता नहीं एयर बबल है या कफ जमा है Doctor, I feel that something is rising in my throat. I'm not sure whether it is air bubble or it is just because of sputum or mucus. So, whenever you just cross check with the patient, do you get this sensation only when you are unhappy or you are angry? The patient will confirm it. Then you can consider this rubric lump in throat, rising sensation, globus hystericus. And for that, we have various remedies like asafoetida, moschus, nux moss, belladonna, and ignitia. Now, here I am sharing a beautiful case. A 47 years old man once visited me for severe headache. His wife said he is very confused, extremely irritable to noise, which causes his headache. He was constipated, complaining flatulence with reflux esophagitis. They lived near railway track. 5-6 trains per day used to pass on the track, which was about 1 kilometer away from his home. He used to put cotton in the ear as the noise making him extremely irritable and causing headache. Previously, he had only gastric trouble, but after shifting in this new home almost since 2 years, his wife noticed strange changes in his behavior. He became hypersensitive to noises, unbearably irritable, and complaining all the time. Sulking behavior, gloomy patient. I gave him asafoetida 10 mg. After 2 months, his wife reported he loves to watch train passing on the track. See, there was hysterical sensitivity and hysterical reaction to the noise, which is causing headache to him. So I cut down that reaction and he became normal. Because the train which is passing only 5-6 times per day and that too 1 kilometer away from his place, how can it create headache in the person? But it is his hypersensitiveness to the noise. Usually, hysteria is a pathognomic symptom. A pathognomic symptom for us sometimes can be also characteristics. There is also the tendency to have hysterical cough or convulsions, and you will find all that in the repertoire. And we have one more rubric, that is hysterical paralysis. Here you can see I quoted two rubric: cough, attack of cough in women with hysterical attack. So we have 8 remedies for such condition. And in general, when there is convulsion, hysterical convulsion. What is hysterical convulsion? This is not epilepsy. This is hysterical convulsion. You know, usually the patient of hysteria gets convulsion only where, only in the place where he will have at least 8-10 people to support him. Where he knows that I am not going to fall on the floor and I will not get injured. In real epilepsy, patient will get injury when he will fall on the floor, but in hysteria, patient will never get the injury because he always get the convulsion in presence of somebody who can hold him, who can support him. We can find hysterical faintness both under the general and in the mind section. See, one rubric at 2 sections in our repertoire. In general, hysterical faintness, 27 remedies. In mind section, fainting hysterically due to hysteria, we have 19 remedies. And the common remedies which are coming up are Cochleus, Ignatia, Chamomilla, Digitalis, etc. Now let me talk about hypochondria. Preoccupied by little things. They have something in their mind. They have the fixed mind and they do not want to change it. They will feel a little lump in their breast and they will be preoccupied by it. They may think that they have a cancer. They will feel a minute lump and they will come to you and you really cannot palpate it. If you will check the breast of the patient, you even won't able to palpate the lump. It's small, like peanut, but the patients keep on talking about it because she is very much concerned about this lump. Even if they go see one doctor, they have to see another one and another one, and they never get satisfied. They just love to play doctor because they do not get the satisfaction with one doctor. And they always think they have something serious and keep on playing doctor. See, like in our practice, clinically, we get few patients. They always give us the hint. Doctor, if you need, just write some investigation, I will do it. Because I know that I'm suffering from some big pathology and I don't want to land in serious disorder. If you will suggest them, see, my dear, right now you don't have anything and we can just go with this remedy. After 15 days, we will see whether we need some investigation or not. Trust me, the patient is not going to visit you after 15 days because he will feel that I am in a severe trouble and this foolish doctor is not able to understand that. So if you have such patient who is insisting you to write the investigation, please write it for him because it is a part of treatment. You are making him satisfied mentally. So please go ahead and do it. See, this is the example of hypochondria. If you don't like my diagnosis, you could seek a second opinion. I have already done that and you are about the 10th. So he will change the doctor, but he will not change his thought. According to Greek medicine, certain organs were the seats of certain emotions. For them, below the ribs were the seat of emotions, anxiety, and despair. Hence, hypochondriasis means anxiety about one's condition with a feeling of despair. And we have lot of rubrics in our repertory for hypochondriasis. The general rubric hypochondriasis, we have 137 remedy. Then we have hypochondriasis with fear of death. See, you can use this rubric nowadays because of this COVID and post-COVID depressions, post-COVID mental disorders. You can use this rubric because still patient has this fear and they have the fixed mind that I will die if I'll catch the COVID. So you can use this rubric and you can provide this remedy to the patient. Then hypochondriasis from insults during menses or suppression of menses or from sexual abstinence. See, remember one thing. Whenever you have any patient suffering from psychiatric disorder, always there is some relation with his sexual life. So please feel free, don't feel hesitate to ask straight about sexual life. Just ask him about his bedroom life and how many times they are performing the sex, whether he is satisfied or not. Because you may get clue here to select your remedy. Even they have the excess of sexual practice, then also you may have the patient of hypochondriasis. And there can be hypochondriasis which can drive the patient to the suicide. So we need to be aware about hypochondriasis. We need to consider this rubric in our patient. Because I have seen in my practice, various junior doctors, what they do, whenever they get any patient with any type of anxiety, they just consider the rubric depression or sadness. No, my friends, there are different rubrics. It can be anxiety, it can be neurosis, it can be psychosis, it can be hypochondriasis, it can be hysteria, it can be OCD. All the time it cannot be depression. So you must have the complete knowledge of psychiatry before dealing it. Otherwise, you will spoil the case and you will lose your patient's trust. Now, I am sharing here few golden secrets from Organon for successful practice. Though it is not a part of our today's webinar, but still I put some 8-9 slides for you. Hope you will enjoy this. Hahnemann studied history of medicine and perceived the importance of phenomena of similia. In his book, Friend of Health, he mentioned everything about brain substance, the injury to the nerve, and how the microbes enter in our body. But at that time, there was no word of microbe or bacteria or organism. So he used just something enter in our body, some creature or something. And that's why he first considered the syphilitic disorder and later on he derived the syphilitic miasm from this syphilitic disorder. But only unbiased mind can perceive the thing. So our mind should be unbiased to learn everything about pathology, which Hahnemann experienced 200 years ago, not today. The first is be kind, empathetic with the patient. Understand? Be empathetic with the patient and be kind. Hahnemann was the first person to talk about the necessity to treat the insane with kindness and compassion. Second is pay attention to mental and emotional changes also in acute disorder. Sometimes we just prescribe the remedy in acute symptom by seeing 1 or 2 characteristic symptoms. But if you know the patient thoroughly, the patient is already your old patient and he is visiting you for some acute disorder, you know the history of the patient, plan your acute remedy according to his mind. For example, any patient is consulting you for severe cough and cold because of exposure to the cold air. And we always think about economic. But if the patient is not that much playful or active person, he's a gloomy person, he's a sluggish person, then aconite won't work in this condition. Though it is a acute remedy for such condition. Here you have to think about opium. Your aconite is not going to work. Then consider types of emotional and mental diseases, whether it is true mental disease or false mental disease. Then how to get recovery in these diseases. In aphorism 218 and 219, Hahnemann mentioned that find out the original physical symptoms which have turned into mental diseases. Because see, whenever we suppress the sora, for example, we suppress the eczema for a long time, gradually the patient may land in psychosis. And if you want to treat the psychosis now, you have to evolve the sora again. So you have to give such remedy which can throw the eczema out. Then consider the wholesale case. Just don't consider the local part before treatment. Consider the person as a whole. Use physical or general symptoms to differentiate remedy. Sometimes in mental diseases, it could be a very strong physical symptom that will be your chief symptom to find the remedy. Like in psychosis, if you have lot of mental symptoms from the patient and you plan some remedy, but later on during the physical examination you found that there is brittleness of the nails, the nails are totally brittle, then you add this rubric to the patient's totality and suddenly you get some other remedy. So it is very important to pay the attention to all the objective and subjective symptoms. Then use deep acting antisoric and antisyphilitic remedies in psychiatric cases always. Because SORA, if you won't treat the acute diseases, SORA will have the tendency to return. And this time it will be with the strong comeback. So it's better to control the SORA at the correct time. As Hahnemann used the term, it will return with the vengeance. Then the reality of psychosomatic diseases. Now let me talk about this. It is very interesting. Hahnemann mentioned about them in first edition of Organon in 1810, almost 150 years back, before the acceptance of modern medicine, which accepted the term psychosomatic disorder in 1956. In aphorism 226, Hahnemann tells that if the psychosomatic condition is, sorry, I cannot see. If the psychosomatic condition is not cared for or stopped, then it will eventually progress into some of the most serious physical diseases that will be observed. And this is true in his time as it is true today. Understand? So we are more knowledgeable. Now tell me who is more modern? This modern medicine or the homeopathy? Then next, success. The key to success is understand psychosis and neurosis. Now, how to decide the prognosis in such cases? Because we always have two types of cases in our practice. One is hopeless and second is hopeful. You can treat the hopeful cases, but don't put your hand in hopeless cases. Because if you don't understand the prognosis and you will put your hand in such cases, you will get the failure. And again, the patient will lose his interest and his confidence in homeopathy. So by our mistake, we are spoiling the image of homeopathy. So don't do that. Be a true homeopath. For that, you must have the complete knowledge of prognosis of such condition. Now, how to decide the prognosis? Two things. First, from knowledge of pathology, like lab investigations, and from your clinical experience. Good prognosis can be expected in the cases if patient shows peculiar, rare, and characteristic symptoms. If there is strong desire to be all right, and if the patient's lifestyle is really healthy. For example, if any patient is visiting you for gallbladder stones or polyps along with the parenchymal disorder of liver and present condition, in his present condition, he has ascites too with pleural effusion and the patient is eating lot of fried food. He is not ready to change his lifestyle. Don't put your hands in such cases because you are not going to cure the patient. Because all the time only medicine doesn't work. You have to give some nutritional changes, you have to give some dietary restriction to the patient. If the patient is not able to change the lifestyle, he is not ready to accept or to follow the new healthy lifestyle, then your case has very bad prognosis. Don't take such cases. If the complexity is more, prognosis is less good. Be patient, open the layers of the disease. You can still have some chances to cure the patient if you are able to open the layers. But for that, you must have the knowledge about the hierarchy of the layers. Which layer you have to deal first. If any lady is consulting you for migraine, and if there is a history of contraception pills she has consumed for years, then which layer is disturbed here? Endocrinal axis. So for that, you have to address her endocrinal layer first, then only you are able to deal with the migraine for permanent cure. If you will cure, if you will try to handle the migraine directly, you won't get the result. You will get the partial result and relapse is there. Understand? If the real disease picture is polluted with past treatment, then the prognosis is really less good. It's really bad. Because usually patient consult a homeopath for psychiatric disorder only when he has done with other school or when they develop the resistance to their allopathic treatment. Now their treatment is not working well for them. Then ultimately in the last they knock your door and they said you that we thought that we should try homeopathy now because our medicine is not working and we have a lot of side effects from that. So we thought well, either homeopathy will benefit us or if you are not going to provide any relief to us, still it is well and good because we know that homeopathy doesn't have any side effects. This statement is really offending. I always feel very offended by such statement given by the family. But you cannot change their mental. You can change their mental only with your work, with your results. So keep patience, open the layer and treat the patient. Then anxious patient who loves to play doctor. Prognosis is less good. Self-medication. Prognosis is not good. Internet loving over smart patient. Prognosis is not prognosis is not good. It is really bad because they always have the fixed idea that I have learned this from internet, I read this from internet, and it is really very bad. So they will ask you, they will puzzle you with their lot of questions. So ignore such type of patients. Greater the vitality, better the prognosis. But for vitality, you should focus on three things: good medication, good case taking, perfect selection of rubric, perfect selection of remedy, nutritional changes, and dietary restriction of the patient. Just suggest them good lifestyle. Greater and the last is greater the experience of the physician, better the prognosis. And hence, I always suggest the delegates that they should not put their hands in psychiatric disorder until and unless they are experienced with the 10 years experience they have of homeopathy practice and they have a good knowledge of psychiatry. Then only you should take such cases. So I think I explained whatever was related about the today's webinar topic. Thank you so much for your patience listening. You have all my contacts here. So and we have this session we made it live on my page and Karthik's page too, and all my contacts here. And if you have any further information, you want further information or informative videos, you can anytime subscribe my YouTube channel, that is Dr. Kavita Chandak, so you can enjoy the some informative videos. Right now if you have any query, I would love to answer them. Rashmika, it is
Yes,
all yours.
doctor. Yes,
All
doctor.
yours.
Amazing webinar, doctor. I think this, like you said, experience speaks a lot. So like in the initial when I said that it's a very close to heart topic because I anything related to mental health I really love the topic. Psychiatry is something which I've always wanted since childhood, that I wanted to pursue the thing, and that is the only reason I think I've joined homeopathy. I wanted to do homeopathy and not anything else. Is this and like you said, everyone will grow with learning and with experience only. So hopefully I get the at least 10-20% of experience how you have.
Yeah, sir.
Yeah, like and like you said, the layers, such a complex stuff that you'd put it in a simple picture. It's just a layer of an onion peel that you need to just find the exact layer of what to do, what to deal first, and what
Yes.
to I think that is a very it's a very complex topic in a very simple picture. You have explained it to us today. Anjali Sharma has asked, "Ma'am, is headache connected with gastric complaints?"
Yes, my dear. Anjali, whenever we have the patient suffering from migraine is always associated with flatulence. Migraine has the origin in the abdomen, and modern medicine says that it is a idiopathic disorder. We do not have the pathology behind it. We do not know the etiology behind it, but we know the etiology behind it. Migraine is always associated with the gastric trouble, especially constipation is there, and when patient is not able to release the toxins or the toxicity and the stool from the uh, anus or rectum, then the body throws out from the mouth in the form of vomiting, and that's why we have the relief from vomiting in the migraine disorder. Hopefully I answered, Anjali.
Uh, Rahul Dugard has asked, uh, how to know when when normal and abnormal any psychiatric condition? I'm sorry, Rahul, if you can specify your question.
Rahul, you can unmute. I think let him
Yeah,
ask
I
his
will.
question. Yeah.
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 Rahul, do you want me to unmute? Are you comfortable with speaking directly? Just send a yes so that I can unmute you. Any other questions till Rahul messages back?
Rashmika, Rahul is not a homeopath.
Oh, okay.
He is by profession CA, and
Oh, wow.
yes, and he messaged me few months back after seeing my one webinar that, ma'am, literally his words were like this, means I cannot express my gratitude for him, and from that day he is following me very well. He is watching my every webinar, and he is following me on my Facebook and YouTube too. He is
Wow.
CA by profession, but he has a very good knowledge of homeopathy.
That's lovely. I think age has no bar or profession has
Yes.
no bar. Once you fall in love with something, once you feel curious about a particular stream, particular information, I think your entire heart goes to there. Uh, Mr. Rahul, I've
Hello,
actually unmuted you. Yeah, correct.
hello,
Hi Rahul.
hello, hello, ma'am.
हाँ राहुल बोलिए.
मैम आई जस्ट वांट टू नो कि एनी
Mhm.
कंडीशन कब पैक्रेटिक बनती है एखादी ओसीडी हैबिट है व्हेन इट बिकम डिसीज.
See, when it is habit, it is within a normal limit. When it crosses the normal limit, it becomes disease. Like we are washing hands for cleanliness, because since our childhood we learn it from our parents to wash the hand before eating, isn't it? It is in our culture. They teach us, and it is our manners. But gradually the patient start feeling, if the patient start feeling that everything is contaminated, if I shake the hand with any person, I have to clean it because I may get some infection from it, then it is the part of disease. So if the patient is taking everything sportingly, positively, as just a habit, then it is just a habit, it is normal. But if the patient is following anything out of fear, then it becomes disease, then it becomes abnormal.
थैंक यू मैम.
जैसे कि like
Welcome,
if a
Rahul.
person like washing exactly like you said, washing your hand once before you're
Yes.
eating, that's a habit. But वही like before eating you feel that the need, you feel that there is something wrong going to happen, so I have to wash my hands 15 times continuously तभी मैं I can शांति से eat. That
Yes.
becomes that becomes abnormal then.
Yes. Rashmika, in Syphilinum remedy, patient has this washing mania, and they always wash the hand because of fear of contamination.
Yes,
उनको लगता है कि मैंने इससे हाथ मिलाया, मेरा हाथ खराब हो गया, मैंने
हाथ
टेबल को
खराब.
छू लिया, मेरा हाथ खराब हो गया, मैंने खुद को छू लिया, मेरा हाथ खराब हो गया. मतलब हर चीज से मेरा हाथ खराब हो गया. खराब मतलब डर्टी नहीं हुआ, उसमें जर्म्स आ गए. अब ये जर्म्स मैं कुछ भी करूंगी तो मुझे कंटेमिनेट करेंगे. मेरे पास एक पेशेंट है रश्मिका right now. She is
हाँ,
from Mumbai and she is working in IT sector at a very high post. And she contacted me on Zoom. She is my online patient, and
हाँ,
she gave me her history. She has the fear of disorders just because of this strong hatred for the dirt. Whenever she is living in Mumbai, and you know which type of houses and buildings and roads Mumbai have. Whenever
yes,
her auto or her car passes from the dirty places, like from the dustbin, big garbage bins, she get the nausea and vomiting. जस्ट बिकॉज ऑफ दिस फीलिंग कि अब मैं कचरे के डब्बे के पास से गई तो उसके जो जर्म से वो उड़ के मेरे पास आ गए, अब मुझे कुछ होने वाला है.
Abhi doctor,
Yes,
is this, can you classify this as a germophobic person or an OCD or just hypochondriasis? Because she
yes.
is mentally feeling that she's feeling nauseatic, that comes into hypochondriasis. But is it germophobia or OCD?
See, in simple word, if we want to see it through the eye of homeopathy, I will consider this patient as syphilitic miasm.
Syphilitic miasm, yes.
Yes, correct. Because उसमें आपकी तीनों चीजें आ गई. हाइपोकॉन्ड्रियासिस कब हो गया? जब वो फियर उसके दिमाग में है. लेकिन
Yes.
फियर कैसे आया उसके दिमाग में? बिकॉज वो ओसीडी बन गया. यानी ये थॉट उसके दिमाग में आता है विदाउट हर विल. वो चाहती नहीं कि वो ऐसा सोचे, लेकिन वो थॉट उसके दिमाग में आता है. अभी क्या हुआ रिसेंटली, शी गॉट सेपरेटेड फ्रॉम हर फैमिली and she wanted to shift to her own flat. She has one flat in Mumbai, but she is not shifting there. She is living in PG. You know why? Because few days back she gave it to some college boys, tenant who are there. They use this flat and their bachelor's use, you know, it's a dirty use. But
Yeah,
later on
yeah.
her father got it renovated. They painted the complete flat, but still then she is not ready to live there because of the feeling that once upon a time they made it dirty. So how
Dirty.
will I
Okay.
use the same toilet which they have used few months back? I'm not going to use the toilet. And that's why she is searching a PG right now, the building which is totally new construction,
New
brand
entry.
new
Yeah.
construction. So that she will be the first person to stay there.
Oh my God.
Difficult to deal such cases.
Very true, very true.
Yeah.
Doctor, we have a question. Pratna Shitwe has asked, give us some tips on elicit mental symptoms at first case taking.
Can you elaborate it because it is a vast topic?
Hmm.
Which type of tips you want, Dr. Prashant? Prathana. Okay. Which type of tips
Pratna.
you want, doctor?
Meanwhile, till Dr. Prathana is asking us questions, typing it out, we have Dr. Sangeeta who's asking, repeated drinking of tea, is it OCD?
Yes, and we have the remedy arsenic album for
China.
this. You know, we have the remedy arsenic album and China too for this. I think Rahul added it. Yes, thank you,
Yes,
Rahul.
yes.
But arsenic is a top remedy when you have the frequent desire to drink tea. Not only tea, we can consider it as a stimulant. So you can consider the rubric desire for stimulant, and then you will get the
Stimulant.
remedy Merxol and arsenic. Again, the syphilitic remedies.
Syphilitic, yeah.
Yes.
We have Anjali Sharma asking, ma'am, I have a case. Can I ask or discuss?
Yeah,
Okay.
please, please.
Anjali, yes, yes, 1 second, Anjali. I will just give you access to talk then. Yeah. Meanwhile, Pratna has asked nature. So you mean, do you mean the nature of the person when the person comes for the first case taking?
Oh, okay, okay. So let me throw some light on this. See, when person enters in your chamber, you just observe the patient, how he is coming, whether he is confident, whether he is shaking hand to you, whether he is doing showing some etiquettes by doing hello or namaste to you. So you will get the confidence level. If the patient is gloomy, some patients just enter in the chamber and they sit and
Eye
they
contact.
immediately, yeah, there is no eye contact and they will look here and there and they just immediately start talking like this. डॉक्टर मुझे बहुत साल से माइग्रेन है, किसी ने आपका नाम बताया, मैं आ गया हूँ. But before that you need to at least wish a doctor good morning, good night. Okay, no problem. But at least you should tell your name.
Yes.
isn't it? But they do not have the patience to tell you their name, because they are in such a deep state of their mind that they want their problem to solve immediately, and
Yeah.
they feel that you are the person who can help them. So my first insist condition is that the patient, whenever address you, whenever visit you, just address the first thing for which the patient is visiting you.
Presenting complaints.
Presenting complaint, his immediate complaint. Because see, sometimes what happens, patient keeps on telling, डॉक्टर मुझे बहुत सिर दुख रहा है, 3 दिन हो गए, माइग्रेन का अटैक आ गया, मेरा पीरियड भी नहीं आ रहा, लेकिन पहले आप मेरा सिर दर्द ठीक करो. If you want to ask the endocrinal axis, if you want to cross check, and if you are asking the patient, अरे बताओ तो सही कितने दिन में पीरियड आता है, कैसे आता है, डॉक्टर वो सब बाद में पूछ लेना, प्लीज इस समय मेरा सिर दर्द ठीक करो. Because patient is in a deep pain and she just immediately want the relief. So first tip is that you have to handle the request of the patient. You need to address the first request of the patient at the particular day the patient visiting you for that. So just ask the patient, okay okay, मैं आपको यही दे रही हूँ, हेडेक ही मैं ठीक करने वाली हूँ, बट कैसे है ना, हेडेक का संबंध आपके पीरियड से है, तो आप मुझे अगर इतना बता देंगे कि पीरियड कैसे आ रहा है, तो जस्ट एक लाइन, तो हम हेडेक को उससे कोरिलेट कर सकते हैं, क्योंकि हमारे हार्मोन्स जो है ना वो हेडेक पर एक बहुत बड़ा इम्पैक्ट रखते हैं. मैं इमीडिएट आपको रिलीफ प्रोवाइड कर सकती हूँ. यू हैव टू convince your patient.
Explain. Yeah.
Yes, you have to explain the patient, you need to convince your patient that hormones has a relation with the headache, then the patient will answer you. So first address his request immediately, the complaint for which he is presenting himself to you, and second, just observe his gesture. Few people talk like this. Like once I had a patient, he was a some news channel editor at Times of India something, and for him he was a big person. So his body language was like this, अरे डॉक्टर मैं तो आया था आपके पास में, किसी ने आपका नाम बताया, वैसे तो मेरे बहुत बड़े बड़े डॉक्टर्स पहचान के हैं, बट मैंने आपका नाम सुना तो मैंने मेरी वाइफ से कॉल करवाया, तो आपके असिस्टेंट ने अपॉइंटमेंट दिया, मैं आ गया. एक्चुअली कैसा है डॉक्टर, मेरे खुद के पास टाइम नहीं रहता है, बट स्टिल आई केम बिकॉज आई हैव टू फॉलो योर अपॉइंटमेंट. आई हैव लॉट ऑफ डॉक्टर फ्रेंड्स इन मुंबई. देन आई आस्क्ड हिम, व्हाई डिडंट यू consult your friends when they are big doctors in Mumbai? You should consult your friends, you have the contacts. He said नहीं, लेकिन क्या होता है ना डॉक्टर, मैं नहीं चाहता कि फ्रेंड्स को मेरी तकलीफ के बारे में पता चले, कुछ चीजें अपने अपने तक ही रहनी चाहिए. See, one side he is boasting about his personality, I am this and I am that, and on the contrary he is hiding his complaints from his near and dear ones.
Yeah.
Understand? Then he boasted like this, आप एक काम करो ना डॉक्टर, you take my number, and whenever as you explain me that after your medication I'll get something, like I may get some itching or some headache or something, so if I'll get any trouble, you know my patience level is very less, though you explain me everything that I am going to get this trouble, but still then I will ring you, and I want you to pick my phone in just 2 rings. So you just store my number in your mobile, whenever I will call you, you just pick my phone in 2 rings. Rashmi, what did I answer him?
Yeah.
I told him that I do not store the numbers of my patient in my phone, first thing, because they are in my clinic files.
Yeah.
And my helpline number, clinic helpline number is given over there. If I explained you everything that you are going to get headache, so you are going to get the headache after my medicine. And you have to bear it. I have already told you that during headache you have to just divert your mind. You can drink some glucose or tea to relieve yourself. You know everything, and still then you want to trouble us, then you can contact on my helpline number.
Helpline.
Assistant will talk to you. I am not going to store your number in my phone. And at that right moment, I knew that he will not come to visit me after 15 days because I hurted his ego. But sometimes you need to understand where to handle the patient, how to handle the patient, where to satisfy his ego, and where to be straightforward with you. Because you are not allowing the patient to sit on your head. If the patient is really in the trouble and he's requesting you, see, if his way is like this, डॉक्टर मुझे तकलीफ होंगी ना, मैं आपको एक बार कॉल कर लूंगी, बिकॉज आई हैव लॉट ऑफ पेशेंट्स दे टॉक लाइक दिस, डॉक्टर तकलीफ में आपकी आवाज भी सुननी ना बहुत अच्छा लगता है, आई फील रिलीफ जस्ट बाय लिसनिंग योर वॉइस. आप इतना भी बोल देंगे ना कि आप ठीक हो जाएंगे, मुझे अच्छा लगता है डॉक्टर. दिस इज अ डिफरेंट वे Rashmika.
Yes.
So for such condition, I just share my personal number with such patient, because if I'll tell one line and they feel satisfied, it is well and good there. You have to handle. You really need to support such patient. But if the patient is showing that I am a great person and you need to pick my phone whenever I will call you, see, I am not the servant of your father. I am a doctor.
True.
I have my own reputation. I have my own existence. You came here because you needed me. I didn't send the invitation to you to
True.
visit. Understand? This is my way of working.
True. That's true. That's very, straightforward, and the patient has to understand the doctor also. That is why there's a mutual understanding that's necessary to work with.
Yeah.
Won't he be more dominating or a boasting kind of a character? Would that form his constitution, doctor?
Pardon, Rashmika?
The person is a very dominating, is a very boasting kind of a character who self praises a lot, or who thinks high of himself.
Mhm.
So, will this be, a very, will this form his constitution? Will this be the main aspect of his constitution?
See, here we can give him the remedy lycopodium, because
Lycopodium, yeah.
yeah, lycopodium or sulfur you can think,
Yeah.
and you can even think the graphitis. Graphitis people, though they are very simple people on one hand, but on the other part of the coin, they just keep on asking so many times, but they don't consult directly to the doctor
Yes.
because they are aware about their health and they do not want to share it because
Share.
of some issues. That is different thing. But the person, if one hand is dominating, boasting, and on the contrary, he just want to hide, because he's just hiding this complaint from his near and dear ones because of his image consciousness. Because he feels that they have my good image, they know I'm such a great person, and how a great person can have some trouble, how a great
Yeah.
person have some issues about his health. So he just want to boast everywhere. He just want to give them a goody boy image that I am the perfect everywhere. So these people are really hiding people. They are double crossing people. So
Hmm.
we can consider feign sickness either, because sometimes they just boast the sickness to the doctor. They
Hmm.
are not too much, but sometimes they are really sick, but they want to hide and they are boasting their other things to the doctor. So you can take the theorizing rubric in such condition,
You're right. Yes.
theorizing, making and dictatorial,
Hmm.
dominating person, hiding his secrets,
Yes.
and at the same time dominating too.
Dominating. Yes.
Boasting is the first.
Uh,
Braggart. Braggart is the
right.
rubric.
Yes.
Braggart.
Right.
Yes.
On that note, Shobha has asked which rubrics to be chosen for when the person keeps changing the doctor.
They are not satisfied, darling. I explained
Satisfied.
about it hypochondriasis in our session. So I already gave you the rubric hypochondriasis,
Hypochondriasis.
because they are not happy, they are not satisfied with anyone. So not with the doctor. They keep on changing their lawyers, their CAs, and
Hmm.
luckily in India they cannot change their wives frequently.
Doctor, on your Facebook page live, we have two questions.
Yeah.
Ursi Sinha has asked, my son is having OCD of the genital itching, and he refuses to wear jeans or tight trousers and underwears also. What should be his remedy for it? Or more, what?
Yes, we have actually one or two remedies for that. That is hyoscyamus is on the
Hyoscyamus.
top, yes, because they have irritation at genital organ. And then, dear, it is not OCD actually. He must is getting some irritation over there. You need to check it and check it. Check one more thing, whether if there is any rash, there is any itching, or there is balanitis or we have the swelling in penis, or if there is paraphimosis, if the skin is going back or not. Sometimes because of this thing, paraphimosis or partial phimosis, patient feels irritation all the time, and he just uh, try to make the skin back, try to push the skin back all the time, which is practically not possible because of the paraphimosis. Either
Correct.
if the paraphimosis is there, we can treat with homeopathy, or if the phimosis is not partial, it is a complete phimosis only, he is able to pass urine with very feeble stream. then you need to do the circumcision. So every time we cannot consider it as a mental disorder or
Yes.
a OCD. It can be local disorder or genital disorder.
We should maybe,
Yes.
first of all remove the possible diagnosis of physicals and
Yes,
then
yes.
come to a.
And then only you can, because for mental disorder or considering it as a OCD, we need further few more symptoms from his behavior. So it's better if you can mail me or WhatsApp me.
Yes. Dr. Tamanna has asked, what's the remedy for person washing his hands repeatedly? I think we've already spoken about it. How to take the rubric in this case?
Washing mania itself is a rubric, my friend. You can consider, you can cross check with the patient, ask the patient why is washing the hand frequently. Is it because of
Okay.
fear of contamination? If it is because of fear of contamination, we have two remedies, syphilinum and sulfur. If it is just a habit, then we can go for the arsenic because of just desire for cleanliness. But if it is taught by the parents in the childhood frequently, like they have hammered him all the time, wash your hands, then we have the remedy carcinosis. So you have to cross check with the patient why this symptom is there and treat the why behind the symptom.
I hope, Dr. Tamanna, you have your question doubts cleared. Anjali, yes, you can speak. Anjali, I have given you the access.
Yes, ma'am.
Hello.
Ma'am, I would like to elaborate my case in Hindi. Is it okay with
Okay.
Kavita, ma'am?
Yes, yes, Anjali, I am Marwadi, I am Chandak.
Okay, ma'am. Okay, ma'am. Actually, I have a friend. Like she has prolonged menstrual bleeding, and the first it is not periodic. मतलब वो कभी भी आता है and वो
Okay.
कभी भी जाता है. Like it is not like 20 days cycle is not at all managed, and
Okay.
her mother used to have the same issues, and after marriage, when her mother had first child, it was sorted, like the problem is now clear for her mother, but the same problem is suffered by this friend of mine. Like she has a younger sister, elder sister, but she doesn't have this problem, but she has it. And we went to many homeopaths and all, but actually, according to me, she gives wrong cases to the doctors. Actually, first she used to give all proper case about the complaints and all, and after that, when she understands that now I am like when the doctors try to enter to the mind of the patient, then she starts lying. And I was confused with one more thing, that when patient first gives the clear case, and after that when she itself disturbs the case, then what should we do? Like
अच्छा,
this, मेरे
मतलब
को
आपका मीनिंग ये है कि पेशेंट ने पहले सही केस पूरा दिया और बाद
हाँ
में उसने खुद के ही केस के साथ में मतलब चीजें छुपाना शुरू की.
चीजें छुपाना शुरू कर दिया, एंड मतलब वो पूरा केस ही नहीं देती, कुछ भी झूठ बोल देती. लाइक उसको ना ये दिखाना का था कि आई एम लाइक प्रायर, ऐसे दिखाते हैं ना हम प्रायर है, नहीं मुझे किसी का कुछ फर्क नहीं पड़ता है ना वाला, दिखाते हैं ना कि मुझे सुपीरियोरिटी चाहिए. लाइक डॉक्टर को ऐसे नहीं लगना चाहिए कि कहीं मैं शाय हूँ या फिर मैं थोड़ी ऐसे ऐसे बोल्ड नहीं हूँ, ऐसा डॉक्टर को नहीं पता चलना चाहिए, ऐसा एक है उसमें. लाइक
अच्छा.
आई फेल्ट दैट बिकॉज वो हमारे सामने अलग थी, एंड डॉक्टर के सामने मतलब उन्होंने पूछा उसको कि एक्चुअली जब वो किसी के साथ झगड़ा करती थी तो उसका जो कंप्लेंट है वो एग्रेवेट होता था, बट डॉक्टर के सामने वो बोली कि नहीं नहीं वो तो अपने आप ही बढ़ता चढ़ता रहता है, मैं तो गुस्सा भी नहीं करती, मैं बहुत शाय मतलब एकदम अच्छे से रहती हूँ, मेरे को किसी के साथ झगड़ना वगैरह पसंद नहीं है, ऐसे टाइप का केस दिया उसने डॉक्टर के सामने. तो आई वॉज कंफ्यूज कि ये तो नहीं है,
हाँ.
ऐसा हो गया था.
अच्छा. एक्चुअली वो डुअल पिक्चर दे रही है बेटा अपना, क्योंकि वो कहीं तो भी अपनी सच पर्सनालिटी को छुपाना चाहती है. ऐसा दो केस में होता है अंजलि. एक जब वाकई में पेशेंट को सच में लैक ऑफ कॉन्फिडेंस है, जब खाली डब्बा होता है ना वो ज्यादा बचता है, खाली रोड, समझा. तो जब लैक ऑफ कॉन्फिडेंस है और खुद में कोई क्वालिटीज नहीं होती, तो आदमी वो क्वालिटीज को शो ऑफ करता है. कहते हैं ना कि जो बादल गरजते ज्यादा वो बरसते नहीं है. तो वो खाली ढोल है, वो बजना चाहती है, वो अपने आप को दिखाना चाहती है कि आई एम सच ब्रेव गर्ल, आई एम अ बोल्ड गर्ल एंड आई एम कॉम्पिटेंट. मैं कहीं पर भी कम नहीं हूँ, आई एम कंपेटेबल फॉर द सोसाइटी. बट कहीं तो भी वो अंदर से लैक ऑफ कॉन्फिडेंस में ग्रसित है और वो एक झूठा पिक्चर लोगों को दे रही है, समझा. तो यहाँ पे सबसे पहले एक रूब्रिक कंसिडर करो, लैक ऑफ कॉन्फिडेंस। दूसरा, आपकी फ्रेंड है तो वो इस लैक ऑफ कॉन्फिडेंस में क्यों जा रही है, ये फाइंड आउट करना चाहिए बेटा, उसकी हेल्प करना चाहती हो तो।
मैम यस, मैंने उसका केस एक्चुअली बहुत बार लिया है, लाइक ईच टाइम मैंने सॉल्व करने की कोशिश की है। तो उसने मुझे क्या बोला, मतलब एक्चुअली मैंने उसको पूछा कि लाइक तू ऐसा क्यों बोलती है, तो शी इज लाइक कि वो मेरी पर्सनल लाइफ है, वो उनको पता चल जाएगा तो ही विल स्टार्ट जजिंग मी, लाइक दो इज अ डॉक्टर एंड ही विल स्टार्ट जजिंग मी एंड ही विल थिंक लाइक ये तो ऐसी है, लाइक नहीं ऐसी है वैसी, लाइक।
इसमें एक रूब्रिक और ले ले बेटा, डिल्यूजन व्हाट पीपल विल से अबाउट मी।
यस मैम।
डिल्यूजन में जाना, पीपल वर्ड क्लिक करना, उसमें आपको बहुत सारे सब रूब्रिक्स मिलेंगे, उसमें से जो सुटेबल है वो उठाना। थर्ड थिंग, उसको इस बात से क्यों फर्क पड़ रहा है कि डॉक्टर उसको जज करेंगे, ये जानना जरूरी है।
प्रिजर्व्ड है उसको ना, लाइक अपना पर्सनल चीज है ना, लोगों को बताना पसंद नहीं है। वो उसको ऐसा लगता है कि बाद में लाइक उसने मुझसे बात करना बंद कर दिया या फिर उसने किसी और को जाके बता दिया, ऐसा सब है। मैंने उसका पूरा केस लिया है, बट डॉक्टर के सामने वो कुछ अलग बोलते हैं एंड आई एम इन सेकेंड ईयर, सो मेरे को समझता नहीं कि क्या करूँ।
अच्छा, तुमने कभी उसका बिहेवियर अपने सीनियर्स के साथ में कैसे देखा है?
हाँ, वो बहुत ऐसे सॉफ्ट, ऐसे फैमिली लाइक, ऐसे बहुत ऐसे प्यार से बात करती है, ऐसे दिखाती है कि या मतलब मैं बहुत अच्छी लड़की हूँ एंड ऑल,
अच्छा, और आपके जूनियर्स को रैगिंग करते कि नहीं आप लोग?
हाँ हम बोले।
तो अंजलि आपकी फ्रेंड भी रैगिंग करती है जूनियर्स को बेटा?
नहीं नहीं, उसने रैगिंग नहीं की थी, बट वो ना मतलब वो कैसी है पता है, वो आपके सामने आपको अच्छा बोलेगी बट पीठ पीछे आपके बारे में क्या बोलेगी आपको भी नहीं पता।
ओके, तो एक और रूब्रिक इसके लिए कंसिडर कर ले बेटा साथ में। डिल्यूजन मैंने बताया आपको, पीपल में जाके सर्च करना, एक ये लेना। दूसरा आप रूब्रिक इसके लिए लो, सिक्रेटिव। थर्ड लो इसके लिए एक रेपर्टरी पे एक रूब्रिक है बेटा, हार्ड विथ इंफीरियर एंड सॉफ्ट विथ सुपेरियर। ये आप लो, क्योंकि ये मेडिकल फील्ड में है, आज ये भी कल को डॉक्टर बनेगी, तो ये जो सीनियर डॉक्टर से अपने को जज ना करे, ये जो फीलिंग लेके उनके आगे सॉफ्ट और बहुत जेंटल बन रही है ना, ये कहीं ना कहीं दूसरों के साथ में हार्श बिहेवियर करती है, जिसका दर्जा इससे कम है। आइदर वो आपके जूनियर हो सकते हैं, या फिर सोसाइटी में अपने से लो तबके के जो लोग रहते हैं, अपने घर की मेड रहती है। कभी भी पेशेंट का हिस्ट्री लेते वक्त अंजलि ये जरूर पूछना है ऐसे केस में कि अपने मेड से कैसे बात करती है, मेड को दीदी कहती है या बाई कहती है, इससे भी आपको रूब्रिक आपका क्लियर हो जाएगा। तो ये भी एक रूब्रिक आप इसमें कंसिडर करना ये केस में।
और मैम वो जो वो
और डिप्लोमेटिक एक ले बेटा, एक रूब्रिक और ले, डिप्लोमेटिक, डिसिसिव, डिसिटफुल, ठीक है? डिप्लोमेटिक रूब्रिक, तो तेरा आधा काम तो वहीं पे खत्म हो गया। डिसिटफुल, स्लाई, डिप्लोमेटिक, ये सारे रूब्रिक तेरी फ्रेंड के लिए बने हैं, खिला दे उसको, ठीक कर दे।
हाँ मैम मुझे एक्चुअली, और उसका जो प्रोलॉन्ग मेंस्ट्रुएशन है वो भी ठीक हो जाएगा ना उससे, मतलब वो बोल रही थी वो
ठीक होगा। नहीं नहीं नहीं, जेनेटिकली ऐसी चीजें आ जाती हैं, ठीक है, लेकिन उस समय उसकी मम्मी को होम्योपैथ नहीं मिला होगा बेटा, इसको तो मिल रहा है ना। तो फिर होम्योपैथी कैन हेल्प अस। तो बिल्कुल आप ये सारे सिम्टम माइंड के लेने के बाद में उसमें प्रोट्रैक्टेड मेंसेस करके एक रूब्रिक ऐड करो, और फिर वो जो आपका जितने भी रेमेडीज ऊपर आ रहे हैं ना रेपर्टाइजेशन का सेट, उसमें थर्मल रिएक्शन उसका चेक करो, आइदर चिली और हॉट। समटाइम्स क्या होता है, जो पॉलीक्रिस्ट रेमेडी होते हैं वो चिली भी होते हैं हॉट भी होते हैं, तो आप उसमें से अगर पॉलीक्रिस्ट कुछ आता कंसिडर कर सकते हैं, लेकिन कुछ रेयर और स्मॉल रेमेडी आ रहा ना, तो डिफरेंशिएट इट विद द चिली और हॉट रिएक्शंस एंड देन गो अहेड। इसमें एक दो फिजिकल जनरल पे ऐड कर बेटा, स्ट्रॉन्ग वाले, जैसे यूरिन में अगर कोई पर्टिकुलर ऑर्डर है, या खाने का क्रेविंग में स्वीट का क्रेविंग बहुत है।
स्वेट बहुत है उसको, बहुत स्वेट आता है, मतलब ऐसे बैठी भी रहेगी ना उसको बहुत पर्सपिरेशन है।
पर्सपिरेशन बहुत है ना, तो ये एक ले ले। पर्सपिरेशन बेटा उन लोगों में ज्यादा होता है, ये जो कैरेक्टर आप अपनी फ्रेंड का बता रही है, तो मुझे कहीं तो भी ऐसा लग रहा है कि ये मैग्नीशिया ग्रुप की पेशेंट है, फैमिली से या पेरेंट्स से उसको उतना लव या अफेक्शन नहीं मिला है बेटा, कहीं तो भी ये अपने पेरेंट्स के साथ में मतलब, या फिर इसका एक्सपेक्टेशन पेरेंट्स से बहुत ज्यादा होंगे जो उतना फुलफिल नहीं हुआ होगा, और पर्सपिरेशन इतना स्वेटिंग है, तो थिंक अबाउट मैग्नीशिया ग्रुप, क्योंकि मैग्नीशिया ग्रुप मेंसेस के लिए भी बहुत अच्छा काम करता है और सेक्रेटरी पे भी बहुत अच्छा काम करता है। तो आई जस्ट गेव यू द हिंट, क्योंकि मुझे पूरा ड्रग पिक्चर या आपके डिजीज पिक्चर अभी पता नहीं है आपके पेशेंट का, बट जितना आपने बताया उसके अकॉर्डिंग मैंने आपको गाइडेंस दिया है, जस्ट गो थ्रू इट।
ओके मैम, आई विल ट्राई माय लेवल बेस्ट। थैंक यू मैम।
एंड बी इन टच, हमको भी बताओ क्या चेंजेस आते हैं।
मैंने आपका ईमेल आईडी और नंबर सब नोट किया है, सेव भी कर दिया है।
ठीक है,
आई विल
ओके
डेफिनेटली मैम।
श्योर श्योर, मोस्ट वेलकम। Any more question, dear Rashmika?
Yes, doctor. I think we'll have this last question and we will close up.
Yes.
Um, Ravi Goyal has asked, I have a query. We change medicines after 15 days sequentially.
Mm-hmm.
Sequentially, Dr. Ravi Goyal, can you explain like calcarea cells, lipo, chain? I don't know what the
Rashmika,
question
he
would
is
be.
talking about the trio.
Trios, okay.
Yeah,
Or
he is
is
talking
he
about
talking about
the.
trios or following well remedies?
Yeah, it is the following well remedy है. कैलकेरिया सल्फर लाइको ये ऐसे सीक्वेंस में बहुत सारे डॉक्टर्स देते हैं. But I never followed, Dr. Ravi, I never followed this trio in my life throughout my practice till now, because I just give the patient what is important or what is the need of the patient at the correct time. If suppose आपको लाइको मिल रहा है या कैलकेरिया मिल रहा है, आपको लग रहा है कि पेशेंट 100% कैलकेरिया है, लेकिन कैलकेरिया देने के बाद अगर पेशेंट रिस्पॉन्ड नहीं कर रहा है ना डॉक्टर, तो मैं उसको आगे सल्फ या sorry, I'm talking in Hindi completely. It was only for Anjali. Sorry. So I don't continue with the sulfur or lycopodium just because it is mentioned. If I feel that my patient is the remedy is calcarea and I am sure short successful or sure short confident that my remedy is confirmed calcarea, but still I am not getting the correct desired result, then I will just change the potency or I will increase the repetition of, or more or less what I will do, I will change the remedy and I will give the another remedy from the same family, like either I will go for graphitis or I will go for marble. Understand? So I don't follow this given sequence, because this sequence has been written in our literature as per they practiced previously, but my way of practice is something different. I approach according to the present complaint of the patient.
Ravi Goyal has replied that ma'am, I just confused to differentiate because these are similar.
Confused to differentiate because these are no, Dr. Ravi, they are different, my dear. Calcarea is totally different from sulfur and the lycopodium. See, calcarea is a remedy who always loves to be live in the protection, because ये आपको ऑस्टर शेल में मिलता है, you know that, and they always love to be protected, not lycopodium and sulfur. Sulfur is highly egoistic patient, lycopodium is a patient who is boasting. लाइकोपोडियम हम अपने लीडर्स को दे सकते हैं, दे ऑलवेज गिव लॉट ऑफ आश्वासन एंड डू नॉट फॉलो देयर कमिटमेंट्स. सो देयर आर डिफरेंस, great difference between calcarea, sulfur and lycopodium. Second thing, calcarea is a chilly patient, but as well lycopodium and sulfur, they are hot remedies. थर्ड इज सल्फर हैज प्रिवेलिंग सोरा, सल्फर सोरा की पिक्चर को प्रेजेंट करता है, लाइकोपोडियम मोस्टली साइकोटिक पिक्चर को प्रेजेंट करता है एंड कैलकेरिया कार्ब जो है वो दोनों को प्रेजेंट करता है. थर्ड थिंग इज दैट कैलकेरिया कार्ब जो है ना वो बहुत ही माइल्ड पेशेंट है, लेजी है, कॉन्स्टिपेटेड है, समटाइम्स दे गेट कॉन्स्टिपेशन, दे रिलीज द स्टूल अल्टरनेट डे, इट इज अ टिपिकल रेमेडी. एंड यू विल यू नो कैलकेरिया इज अ लेजी पेशेंट. समटाइम्स क्या होता है, अगर पीरियड महीने 2 महीने तक नहीं भी आया या पेशेंट 4 दिन लैट्रिन नहीं भी गया, तो भी कैलकेरिया पेशेंट की बॉडी रिएक्ट नहीं करती, उसको बॉडी पे कोई सिम्टम नहीं आता. लेकिन सल्फर का पेशेंट अगर 2 दिन लैट्रिन नहीं जाएगा तो उसकी बॉडी पे पूरे रैशेस आ जाएंगे. लाइकोपोडियम पेशेंट अगर 2 दिन मोशन नहीं जाएगा या उसका मेंसेस सप्रेस हो जाएगा तो मेंटली डिसबैलेंस हो जाएगा, हॉट टेम्परामेंट हो जाएगा. So we have various differentiating points, my dear, in Materia Medica. I think you need to read comparative Materia Medica from N.M. Chaudhary. You will get your answers much better.
Doctor,
मैम आप सिलिशिया का कॉन्स्टिपेशन पे एक्सप्लेन करोगे प्लीज?
कैसे बेटा?
मैम सिलिशिया का कॉन्स्टिपेशन.
सिलिशिया का कॉन्स्टिपेशन जो होता है ना, सिलिशिया इज अ वेरी कॉन्स्टिपेटेड रेमेडी, बट सिलिशिया हैज अ स्टिकी स्टूल. You know, Cilicia में there is a characteristic symptom. Stool recedes and go back. Stool comes and recedes back. Any latrine में जब patient बैठा रहता है, तो he feels that his stool is coming downward to the rectum, but suddenly it is receding back. ये एक चीज है. दूसरा, सिलिशिया का स्टूल इतना स्टिकी होता है कि वो पहले तो बॉडी को छोड़ने को तैयार नहीं. कब जाके अगर वो बॉडी को छोड़ता है, if the patient is successful in passing the stool, then it adheres to the pan. It is difficult to flush. Understand? So siliceous constipation is quite different from the calcarea. Calcarea do not get the feeling of pressure. मतलब कैल्केरिया को प्रेशर का फीलिंग ही नहीं होता है, उसको लगता ही नहीं कि मुझे लैट्रिन जाना है, बट सिलिशिया को फीलिंग होता है, और वो जब कमोड पे बैठता है तो घंटों इंतजार करता है कि भैया स्टूल अब तो आ जा। वो आता है लैट्रिन नीचे, वापस ऊपर जाता है, आता है ऊपर जाता है। So Cilicia has different constipation from calcarea.
Okay.
And these small
Okay.
things, my dear friends, you should read from the Matra Medica. I am here to solve the advanced level question, not the basic level questions. Isn't it?
Okay, ma'am. Thank you, ma'am. Sorry, ma'am.
Welcome. No problem. Any more question, Rashmika?
I think, oh, sorry. I just got another question. Really sorry. Um, if a patient is having rashes all over the body during menorrhagia, then can you guide me with some response possible remedies?
Okay. You have to consider both the rubrics, rashes throughout the body along with menorrhagia. See, first you need to confirm whether the patient is suffering from the rashes during every menses, whether the patient is suffering from menorrhagia during every menses, what is the correlation between skin and menses. If the patient is getting benefit, or is there any mental disturbance along with this, you need to check, cross check with the patient, and later on you have to collect your rubrics accordingly. And if suppose if there is no other trouble, and the both things are going together, then you need to consider the rubric rashes on the skin first, aggravation menses during second rubric, and the third rubric is menses protracted menorrhagia accompanied with skin complaints, and then you will get your remedies.
I think we can end the question session with this,
Thank
doctor.
you.
I think it has been a
Yes,
very long, interactive question and
yes,
answer session we had, and I think it was a very fruitful session today because everyone were all in their, tip of their seats and like eagerly listening to you, wanting to interact with you. I think that's a
yes.
sign of a very successful webinar. Thank you so much,
I
doctor.
also love to answer a lot of queries, Rashmika, but I have another Zoom session by 8. So we need to wind up now.
Yes, definitely, doctor. Definitely, we'll wind up with this. Thank you so much, everyone, for attending today, and congratulations, Dr. Kavita Chandak. Good explanation. We're having lots of Facebook comments for you. Okay, thank you so much,
Thank
doctor.
you
With this,
so
we
much.
can
Bye
end the
bye.
session.
Good night,
Have a good,
Rashmika.
have a
Convey my
good.
regards to Karthik. Bye.
Definitely, doctor. Thank you so much.
Good
Have a
night,
good.
everyone. Bye. Bye.